All right. Everybody get in. I want to welcome everybody to part two of our insightful webinar series. The series is on the CEO Convergence, Visioning AI's Role in Future Healthcare Technologies. I am Grant McGaw, CEO of Five Star BDM, and your moderator for today's session. And I am happy to guide you through another transformative discussion about the integration of AI in healthcare. And today we dwell deeper into the implications and practical applications of AI, exploring how it is poised to reshape healthcare delivery systems, enhance patient engagement, and improve long term health outcomes. And it is my privilege to introduce to you our today's panelists. And joining us is Alex Remilio. Alex is the CEO of Health Choice Network, who brings a wealth of experience in overseeing healthcare delivery transformations. And Alex will share his visionary perspectives on AI's role in modernizing healthcare operations and its impact on patient care. And alongside Alex, we have Ronak Shah. And Ronak is the CEO of Agile Infoways, whose expertise in software engineering and AI solutions development has driven significant advancements in healthcare technologies. And Ronak will highlight practical examples of AI in action, such as predictive analytics for personalized patient care and AI driven operational efficiencies. In today's discussion, we're going to promise not only to showcase the profound capabilities of AI, but also to address the vital considerations of integrating such technologies, including data privacy, system compatibility, and the balance of human and artificial intelligence in patient care. Our goal is to provide you with both inspirational and practical insights that could be applied within your own organizations. And as we embark on this discussion, we encourage you to engage with us through questions and comments, making this an interactive experience. So let's begin this enlightening journey together. We're exploring how AI is not just a technological advancement, but a pivotal element in the future of healthcare. And I want to start with Alex as far as my first question. And Alex, as the CEO of Health Choice Network, what is your vision for the future of healthcare delivery that is now being transformed potentially by AI?
Yeah, so first of all, good afternoon, Grant, Ronick. It's good to see you both. In our market, we're in the ambulatory care market. We're in the federally qualified health center market. So our patient population is extremely representative of the communities we serve. So we deal with a lot of uninsured, especially here in the state of Florida. And HCN right now operates out of 27 states. So we have a very interesting perspective for states that have Medicaid expansion versus those that don't. And so we are very excited and already started with machine learning, which now falls under the AI scope, to look at clinical workflows, look at front desk staff operations, look at back office staff, revenue cycle management operations, and more importantly, the patient access. How can we make it easier for patients to gain access to healthcare? We've started with very small steps. Ronna can tell you that it's a journey, right? It's not a sprint. And we've been very mindful of the fact that most of our data does not exist in a structured data repository. So, artificial intelligence requires data inputs to be able to normalize data and provide that. With a 25 million patient uninsured volume in the United States, we understand that a large population that we serve is not currently in a database. So we're being very mindful of the ethical, the diverse data feeds, and to make sure that we don't have any pronounced bias in that data. But we're so excited. Just to give you an example. Last month, we automated 50,000 manual transaction on the revenue cycle management portion that a human would have to do. And that FTE now is more focused on working payer denials.
That's very, very interesting. So you're using the technology today and then we hear about a lot of this a lot. I mean, as far as about efficiency, it's about efficiency, right? Not getting into the other ethical considerations. There's some other things, but if you can make things, especially in today's staff shortages and things of that nature, utilize your time more effectively, more efficiently. I think AI can be a powerful tool. I want to swing this over to Rono because he works in that world on a worldwide scale, working with healthcare institutions. So, Rono, how can AI powered solutions support Alex's vision for a more patient centric healthcare model?
Yeah, thank you for the question, Grant, and good afternoon to Grant and Alex. Alex, welcome to our live webinar today, and thank you for making it happen. So AI-powered solutions, they can enhance the patient experience in several ways. One is, I would say, personalized care. Like AI algorithms can analyze vast amount of data sets, and then it can generate like personalized treatment plans which is more unique to the patient's need. So that's very, very important, because AI can read the patient's history, medical history, past data, and it can give more personalized care. Another bigger thing what we have started working on is all the predictive analysis. Like these AI algorithms can analyze patient data to identify the patterns. Like it can really predict the future health risk, and based on that, healthcare provider can even intervene early stage and implement more like preventive measure procedures. So that's a very big win for the AI in terms of the predictive analysis. Another part is like remote monitoring. We already know that remote monitoring is the biggest win in AI. By AI powered remote monitoring devices are there, wearable sensors that can continuously track like patients vital signs, their activity levels, or even their health metrics. Also, along with that, these virtual health assistants are now coming. It's like AI powered virtual health assistants are there, chatbots are there, and that can really help patients in terms of the education, their appointment scheduling, their medication reminders, or even answer the simple questions. Sometimes even there you don't even need the health specialist to answer all those questions. Chatbots or the virtual assistants will take care of that part more efficiently. Another largest win for a lot of the healthcare companies is the clinical decision support system is enhanced too much. Like the clinicians are making much more informed decisions. Like they are able to reduce the diagnostic errors, and they are kind of ensuring the patients to receive more appropriate and effective treatments. Even the way Alex mentioned, the workflow optimization, that is another great win. Like you are automating a lot of your routine activities like administrative tasks. The way 50,000 entries are all automated by Choice Health Network. Same way, you can streamline the appointment systems. Like also you can prioritize the patient's like patient's engagement based on the urgency and the needs and the resource availability. Like some patients may need treatment earlier than others. So these AI algorithms are acting more smarter. And then now patient engagement and education is wholly changed because of the lifestyle recommendation by the AI chatbots. And these AI powered telemedicine platforms are now coming up. So we have a lot of remote consultations between the patients and healthcare providers, even going in the hospital. A lot of things can be even solved by the virtual care itself, and that can help more. Like remote diagnosis and monitoring is also coming up. So the one of the classic example that we did for one of the company in California, it's more like when we get these medications, we get this in a yellow bottle, and then there's a white cap on top of that. This white cap was, we designed it as a magic cap. It's kind of an IoT enabled cap. So sometimes these elderly patients, they even forget where they kept the medication bottle in the house. So we have the tracking device, where they can find this medication bottle in the house. And then sometimes they have like bunch of bottles and they forget which one was. So we have the full OCR integration, so they can scan the bottle label and they can understand what is this whole medication is about. And then we are trying to have the medication reminder system. We even try to avoid the overdosage. If it's overdosage, it's again a problem. So we track these whole bottle, like how many times they're opening the cap, how many times they're closing it. So we try to estimate how much medications they're taking, and we can even check the remaining pills in the bottle. And based on that, we have a automated ordering system integrated and like that. So there are several benefits to the AI, but this was one of the classic example which is helping the industry a lot by using the magic cap, more for geared towards the elderly patients.
Man, that's wonderful. I like to hear about these innovations, how we can utilize the technology to improve experience. Especially, we've got a huge elderly population. They call it what do they call it? The silver tsunami that's taking place now. Now I know, Alex, he sits on that footprint. 27 states. That's a lot of states. There's a lot of people. There's a lot of elderly people. There's a lot of people that need help. And I want to ask, from a CEO perspective, beyond just the patient care, how can AI revolutionize this efficiency and cost effectiveness of healthcare delivery systems, in your opinion?
Yeah, that's a loaded question, and I'm sure my payer friends are going to love my answer. So, let's look at the data set, right? So, HCN this year will serve about 12 million patient visits. And we run the gambit. We run from cradle to grave, right? From birth, we help deliveries with our hospital partners, and we work through the Medicare ACO all the way to the elderly population and look at making sure they have their personalized treatment plans, which is what Ronak was talking about. From our vantage point, it's still all about patient-centric, patient engagement, and personalized medicine. The reason I bring that up is the dysfunction in healthcare is actually where people make all the money. So if you look at all the money that's been done via the Affordable Care Act, and no matter what side of the aisle you sit on, going from 46, almost 47 million uninsured patients in 2010 to 25 million uninsured patients, it's a huge discrepancy and a win. And then you have, 11% of the population that says, I don't want insurance, right? So you take those out. So for us, the ability to streamline the administrative burden, the 47% admin rate that's many payers add on to before they actually pay a claim, the ability to have care coordinators. So I know my partners in the payer industry have dedicated acute care coordinators and hospitalists to look at how long people are staying in the hospital. Should they have even gone to the hospital? If they're in the hospital, how do I discharge them to a medical home? The new Living Healthy package here in Florida that the governor has put into place says that our hospital partners and our ambulatory partners have to work together. The reason for that is to prevent Medicaid and uninsured patients for re-entering the system via an emergency room, which is very expensive. So for us, that predictive modeling, the identification of personalized treatment plans, understanding predictive risk factors. We were talking before we started about my family history, so I'll share that. My family history is heart disease. So the predictive modeling for me shows that I will eventually suffer from some level of cardiac issue. That means that if a payer is tracking me and has my past medical history and my family history and my genetic makeup and my culture and some of the bad decisions I make during my downtime, they'll know that my risk factor is high. So knowing that my risk factor is high, even though I have not had a cardiac event, allows for us to be able to predictively analyze that data, assign a care coordinator for me, work on a more healthy lifestyle, including diet and exercise, et cetera, and do that preventative care. The preventative care model is really where we can see the savings in healthcare. And the second example I use is what I used previously, which is revenue cycle management. The ability for us to process data, codify that data, and submit it to our payer partners, make sure we're getting paid the right amount, making sure we're getting paid timely, reduces the ability of having staff work on pre-authorizations, referrals, and then denials. And if you look at the entire revenue cycle, right, the entire treatment of a claim, most of it is the dysfunction. It's the amount of hands that it has to touch before it actually gets paid. And that is primarily because either patients didn't provide the right information, the front desk staff didn't collect the right information from an insurance perspective, or there was an administrative block. Just like we had this cyber attack on Change Health and the impact that it had to paying claims, we're talking about hundreds of millions of dollars in delays in payment. So we're really excited about lowering the administrative burden that sits today in healthcare, and in that dysfunction is really where the cost savings come from.
That is such an enlightenment. We all know that the current amount of money it takes to operate in the healthcare ecosystem, I think is $1 trillion or maybe more than that, 20% GPT or maybe more than that. Having these types of efficiencies are going to be instrumental in controlling something that's out of control. So I like your input. I want to bring that over to Roanoke. And can you elaborate on some specific AI technologies that you believe can address some of these points that Alex just raised?
Sure, definitely. Yeah, so there are actually several ways to increase the efficiency, by using the AI. Let's talk more about scheduling optimization, like appointment scheduling. So AI algorithms can really analyze the patient data. They can check the provider's availability. They can even check the clinical, like what's the capacity in the clinic, and it can optimize the appointment scheduling and probably like reduce the wait times. That's a very important. Now another part in the scheduling is the operating room schedule. Like there are operation rooms, but how do you efficiently use them? That's very important by using the AI algorithms. By they can AI algorithms can check the operating room schedules. They can check what procedures are already scheduled and how much complex those procedures are. What's the surgeon's availability? Even let's say AI algorithms, we would check like what are the equipments required for those next procedures that are happening. What's the availability of those equipments? And based on that, that can really schedule more smartly all the operating room and using it more efficiently. It can minimize the idle time and it can really reduce the surgical wait list. And the same way, the third part in the scheduling is your how optimizing you're actually on your staff usage. Like you want to make sure that your staff workload is well distributed. Like there are definitely there is a shift preferences by different staff members. You need to manage that. So you always want to make sure that your overtime costs get reduced, and at the same time you improve the staff satisfaction. So AI algorithms can really help you in both ways. And the third one, another part I would say is more on the resource allocation. Let's say we designed one solution at the time of COVID, which was very, very useful in reality. So we work with a lot of different countries. We work in Singapore, Dubai, healthcare companies, even in India. And taking an example of India is a highly populated country. And in the time of COVID, you understand, like hospitalization was crazy. And luckily we had this solution in place. It was a wellness care solution that was designed for one of the larger company, and that was designed for bed management. Some hospital, they had like number of hospitals across different parts of the world, and they had like some hospital had like 200 or 500 or 1,000 bed. Now how do you manage all this bed while you have crazy hospitalization going on in the time of COVID? So this AI algorithms basically does the full bed allocation by looking at the patient admissions. There are discharges. Some patients are being even transferred to different departments. So based on that, the full AI-based bed allocation would take place. In the same way, we also designed the medical equipment allocation with the AI algorithms. Because if you remember, I don't know more about US, but in other parts of the world, like in India, we had oxygen shortages, at the time of COVID. So this AI system would check the availability, like what are the patient needs, what are the equipment availability, and it will basically do the usage patterns. And based on that, it will design that this is how much equipment we would be able to allocate in this day. So it would give you all predictive analysis on that. And then we had a medical inventory management using the AI. So it would check the medication inventory management, and it will do the medication usage. It will check the expiration dates of certain medication. It can even predict the supply chain disruption based on the historical data. And then it will do the whole medical ordering by itself and try to reduce on the wastage. So this kind of solution was designed for one of the large healthcare organization. And apart from that, like revenue cycle management and all those things Alex mentioned, like there's a big fraud happening in the healthcare industry, so AI algorithms can really check for duplicate billing, it can check for suspicious claims or investigate potential fraud cases and prevent the financial losses for any organization. And another bigger part we are working on is all the identity verification. There's a big theft of identity even in the medical field, so we can verify the patient's biometric authentication by facial recognition or fingerprint scanning or even voice recognition. We identify the patient, and based on that we try to restrict the medical records or only give the data to the right people who are actually authentic user. So this is how the AI can really help in the scheduling, the optimization, or the resource allocation.
That's all important information. I'm going to remind the audience again, because we're sharing knowledge, we're sharing experience. Make sure that you write into the comments to Alex and Ronald, because we're live right now. This is a great opportunity to ask some very relevant questions, because we're about to ask about what I call the elephant in the room. What is that? Alex is the CEO of a very successful organization. He answers to a board of directors. They want to know certain things. And as we get around to it, as AI is playing this bigger role, how can we ensure that the human-centered care can, maintain or is not replaced by AI, as far as that value of the human interaction in healthcare? This is a big discussion, because people are thinking, I'm going to lose my job. This is going to be, can I be repurposed? Can I be retrained? I mean, what are we doing here? As you just alluded to, all this waste that's going on, everybody knows about it. Now it starts to go away, hopefully. How does this change the delivery of care?
Great question, Grant. And so my board of directors is awesome, just because they're the CEOs of these federally qualified health centers. So they're mission based organizations, and they're very supportive of anything that will increase engagement and access. So just to level set, our board of directors looks for a couple things. Number one, remember the electronic healthcare EHR revolution. So we started our journey early. We were one of the bleeding edge. We were definitely not cutting edge. We were bleeding edge back in 1999. And we rolled out our first clinical SOAP note, or clinical encounter note, back in 2000. And everybody thought there's going to be this massive loss of health information management staff. We're going to lose staff here because the system is going to be like the banking industry, and we're going to automate some things, and we're going to lose folks. Well, what we found was, and we can use EHR as an example, is we were able to retrain, repurpose, and hire salaries for some of the staff that were doing low-paid jobs, such as filing away a medical record that would always get lost. And so the efficiency model doesn't necessarily mean there's going to be a loss in wages. As a matter of fact, we see higher wages going. Our workforce shortages are showing that. So I use that as a good analogy with my board. But the big elephant in the room for us, besides that fear, is how to invest. What's the ROI on the AI investment? Because as Ronak mentioned, there's all these amazing tools being generated, and we're just on the precipice of this amazing tsunami, as you mentioned. Our biggest elephant in the room is making sure that we are well represented in the data. So if you look at clinical trials today, only 75% of all clinical trials reported by the FDA only show 8% African American, 6% Asian, 11% Hispanic, and the rest are white Americans. So we know that some of the data, when it comes to clinical trials, which develops the best clinical process for treatment, the data has some bias in it. So our biggest elephant in the room is, one, how do we make sure the uninsured and the rest of the population that represents this amazing country we live in the United States, represents every patient, number one. And number two, and I think even more important than that, is how do we address the data from a life experiences perspective? Whether it's mental health, whether it's oral health, unhealthy behaviors, such as substance use or sedimentary lifestyle, like we were talking about, or risky sexual activity, health promoting behaviors like adequate sleep, stress levels, preventative care. And what we're really excited about, and our board is really focused on that, is as we go deeper into AI and move away from some of the efficiencies in the administrative side, we start looking at improving and enhancing diagnostic accuracy. So imagine that the system will help us review medical imaging faster. We work with the Promise Fund here, and that is an ability to be able to do mammographies to uninsured and Medicaid patients that usually go without preventative care, such as mammographies. 50% of the cost of a mammogram to an uninsured patient is reading the image. So if we can get diagnostic AI imaging reading and lower the cost there, it doesn't put anybody out of a job. As a matter of fact, it allows us to get more appointment slots for patients that need it. Specifically our community that is made up of brown, Black, Hispanic, Asian, you name it. And that to us is the elephant in the room. Is we know the power of AI. We know how it can optimize clinical workflows. We know how it can personalize medicine. We know how it can improve patient access. But as we look at moving into the clinical side, we want to provide our clinicians and our physicians more data to make better decisions, and also look at all the data around the globe on one patient and say, this is the most relevant treatment plan with the best outcome for this patient based on the information we have. But at the end of the day, that highly skilled clinician or physician is going to make the ultimate decision.
This is so important to understand. And this is the reason why we do these webinars, is that we've got to get good knowledge and good information and wisdom out into the workplace so people understand there's always going to be a shift. Like, what were you doing before you had a mobile phone? How were you communicating? What were you doing before you had a fax machine? All these kinds of things. Yes, it'll be a change, but it should be the change to the positive. We should be taking some of the friction out of the healthcare delivery system and making it more efficient so that you get more hands-on care, better outcomes. Like, man, we had that discussion earlier this week, and just understand that sometimes the data doesn't always tell the story. If you don't have enough data, you don't have the right data, is it telling you the right thing? Because if you're looking at a population that doesn't always utilize technology or data as opposed to others, and then you get these skewed results that can lead you to wrong answers. Elaborate on that just a little bit more, Alex, because that was so important.
Yeah. So, and Ronak actually used the best example, if I can elaborate on his example, was the inefficiency of patient scheduling, right? So I'm an American, and I have a full-time job, and I have children that I have to pick up at school and aftercare, and I'm just like everyone else. And so I may schedule an appointment 3 months from now for my annual wellness visit, but the appointment system gives me one option. In every other industry, we're giving a primary option. Even when you make reservations at a well-established restaurant, they'll give you some additional options. AI allows us to take a father of 2 beautiful daughters with a crazy job and high stress and poor health hygiene and say, hey, we know you're busy. We're having an appointment slot early in the morning, or the reason why you're coming in, you don't have to come in. We can solve this via virtual consult and save you the time as a preventative measure instead of all or nothing. And so back to your point, take that example and say, if I'm only going to the doctor once a year and I'm a Hispanic male, what data is missing from my past medical history since my entire family is from Europe, right? The good thing about AI, and I know Ronak can speak about this, I'm actually setting you up, Ronak, is the data also can tell us where the gaps are and make assumptions to include the gaps. So part of the ethical and diverse, and we have a council we're actually forming just about AI. We want to have a multidisciplinary council at Health Choice Network that includes physicians and staff and patients of all makes and creeds, and be able to say, make sure we're not missing something. But the exciting part for me when it comes to AI is the fact that the algorithms are also now built to understand there's gaps in the data, and there's bias in the data, and there's lack of diversity in the data. And if there are gaps or lack of diversity, what would be the negative factor of that. And the example I use, I did this live on stage at my annual conference last year before we even had ChatGPT had just come out. 3.0 had just come out. I asked ChatGPT online in front of my entire 400 audience, which was incredibly stupid at the time because the technology can fail us, as we know. And I asked AI, show me a physician. And I kept refreshing it. And I did 30 images of a physician. Guess how many times it showed me a female physician? 0. Now, you would say there's bias in the data. Coming from a single mom's house, I would want my mom a woman representing physicians. We know how many great female physicians are in the industry. It wasn't biased. If you look at the percentages of male physicians to female physicians, while it's increasing, but if you go back to the beginning of modern medicine, over 87% at the time of physicians in the United States were male. So I only clicked 30 times. I had to click over 87 times to get that 1% if we're doing simple math. And so I use that as an example of look how powerful this is. At the same time, we have to have councils to govern this before we just roll it out in this massive wave, because I think everyone in healthcare wants to save a dollar. We want to make sure that we can provide the best care. We want to make sure we have safety for our patients. We want to make sure that we lower, like the electronic health record did, lower inaccuracies in diagnostic and medication errors, which we've done. And we want to improve that further. But at the same time, we want to make sure we're at a pace that is keeping up. And the last thing I'll mention is we are also causing what's called a technology divide. We do have patients that are elderly, but we have great patients that are over 70 years old using patient portal, smartphones, RPM, et cetera. But we have a technology divide also from an educational perspective. If we're not doing it in third grade English, if we're not doing it in multiple languages, we're missing a huge opportunity. And so I like the fact that the data now has the algorithms to understand the bias and also the gaps.
That is so important. We're having real discussion. We got to roll up our sleeves a little bit. I'm going to swing it back over to Rona, because what we're talking about, we're introducing a technology that could potentially change the human experience. How do you see this as we start looking at it from long term, improving patient and population health outcomes? As a technologist, do you take that into consideration?
Absolutely, Grant. So AI has really a great potential, and it's kind of a game changer, I would say, where you can improve the population health outcome. There are several areas that can be focused, like preventive care or chronic disease management or early disease detection or something like that. So every area has full potential. Like if you take preventive care, like AI can really analyze the vast data sets. It can check the medical history, demographics of that person, or the social determinants of the health, and it identifies the individual at high risk of certain diseases. It understands your lifestyle, your social factors, and it can really predict what you are gonna have. Like it can also give you personalized prevention plan. It can really suggest the personalized preventive measures, and it also can give you like diet recommendations based on your poor diet habits or whatever. It can give you exercise programs, and there are AI based lifestyle coaching systems are now also coming up. So they are kind of start coaching you, gives you mental support, it gives you healthy lifestyle suggestions and like that. So the second most important part is the chronic disease management. So we talked, even Alex said remote patient monitoring, but it can really analyze a lot of data by your wearable devices or the sensors. You can monitor the patient so easily, and that can help you more on the early detection of any diseases, and then you can do a timely intervention and give the treatment to the patient. And the same way, by when using these AI algorithms, you can manage the medications. Now the biggest thing that AI algorithms are coming up, it can really check your own real-time health data, and it can optimize the medication dosage based on the real-time health data. That's isn't ridiculous. I feel it risky sometimes, like, okay, my medication is going to be changed by the AI algorithms by reading my health data. So that's something a little tricky. We feel it little scared, but it is the truth, So we are working with one of the larger company in New Jersey, and we are actually implementing their 200 locations. This whole solution that I'm talking about, it's a full remote patient monitoring system that we have designed, and we take a lot of patient data by their glucose monitors, we have blood pressure monitors, we have a pulse monitor, and we take all these data and we basically remotely are monitoring this all patients by wearable devices. We keep track of their medication usage even remotely, and these AI design systems that we have designed, it actually designs the whole care plan based on the patient's symptoms. That's a very big thing. Now the most important part that we've designed in this is, even this is a remote patient monitoring system. These patients are being monitored, but these healthcare providers cannot bill the insurance company only for monitoring purpose. That's a biggest problem. So the whole solution that we've designed is, when these patients have a different activity levels, or their signs are not good, and when the healthcare providers are actually treating them even remotely or whatever the way, we actually clock all those timings and everything, and then we have a full automated billing. So there are no disputes from the insurance company that if we're going to deny, we're not going to pay you. They only bill the time that they are spending on every patient based on their health activity level, even on the remote patient monitoring solution. So it's a big win for this company. As I say, they are implementing into 200 locations right now. And there are other items, how you can improve more population health outcome is by, Alex already said that, about the image analysis, like early disease detection. AI algorithms, they analyze medical images like x-rays or mammogram with exceptional speed and accuracy. That's a very big win in the industry already. And this genetic analysis, that is also a very big thing. It's like AI can analyze the genetic data much better, and it allows early intervention and gives more preventive measures. So these are the few ways I would think that the AI would contribute to the improving the overall population health outcome in the industry.
Well, let's continue on that track, because Alex, you brought up some very interesting things around, and what Ronak just said, mammograms, and specifically in the population, a demographic, African American women, or we're going to talk about even the birth rates, right? And then how that you have data there, but is it really telling the story? And all these things, as you identify individuals, are they at risk for certain chronic diseases? How do you see AI playing a role in that area?
Yeah, I have this example that I just learned. So this is something I've also been looking at the data as well on. So historically, African American women have some of the worst healthy birth outcomes in this country, despite the high cost of healthcare, access, and obviously focus groups. And yes, the data has shown that receiving prenatal care in your first trimester versus third trimester will highly improve the outcome of a successful birth. So immediately, we run to the analysis or hypothesis that women, specifically African American women, are not seeking prenatal care early on. And while that is not false, the paradigm shift for us now with AI and machine learning is the data is also showing us we have a lot of gaps in African American OB obstetrics providers treating these women. So does that mean that because we don't relate, because we don't understand the community challenges, the food deserts, the inability for transportation, the inability to gain access on time? What if there is only one obstetrics and gynecologist in your community that's also African American or matches your race, ethnicity, or something you're looking for? You're looking for an OB that also has children. You're looking for a female versus male. But what if you find one and their next available appointment is 8 months from now, and you just found out you were pregnant 6 weeks ago? So that is a perfect example of how well machine learning, data synapses, artificial intelligence, generative AI helped us look at a human factor. But it took the humans, our clinical research team that is very well diverse, that represents our community, to say, aha, there's another data point here that we can actually work on to be able to improve the infant mortality rate and or successful pregnancy of an African American female. The other option, the other item that I love to hear all the time about is when you ask the homeless population. We have an increasing homeless population. We have an increasingly mental health status in this country that has to be addressed. If you're a provider, a payer, or a hospital system, you're looking at your ER utilization. And if one patient's coming to you 30 times a month, you're looking at that as a high-risk patient with a high cost, and in some cases, a catastrophic case if you're looking at it from a financial perspective. Sometimes it is truly just a mental health issues, and they're trying to seek access with another human. AI is not going to solve that, right? But it will highlight that this patient is prone to these type of tendencies, and what can we do ahead of that? We were the largest Medicaid payer here in the state of Florida. We had about 300,000 lives that we were responsible for. And one of our catastrophic cases was a male between the ages of 35 and 46 that sought emergency room care 7 to 10 times a month.
Wow.
So that came up as a catastrophic case, right? Very expensive, et cetera. We then find out via the data that it's a 612-pound male. We also find out that the only transportation that was safe for this patient was a very equipped, high-level type ambulance that not the average ambulance can transport. And the primary diagnosis most times was GI issues. So male, over 600 pounds, requiring special transportation, 7 to 10 times a month. In any other data model, we would show, of course, we have a situation we have to address. Well, it didn't take AI. It took data to show that all we needed was a care coordinator in a Prius sitting outside the home. They were looking for human interaction. They were in isolation. They lived in a 10 by 10 apartment. So it's important that we recognize that while artificial intelligence is here to stay, I know one of the comments was here to stay from Dr. Visi. It's important that we recognize that we will still need that human interaction and that understanding of the human psyche to be able to make smart decisions that data is going to help us with. But at the same time, they're humanistic and holistic decisions on the right thing to do at the right time. And just to answer one question that came up earlier about the physician wearable glasses, and I know Ronak talked about wearable devices, we're seeing a huge penetration in that market for physician training. We have a workforce shortages, since prior to COVID. I mean, we've had a workforce PCP, primary care physician shortage in this country for decades, but obviously it's exacerbated now with COVID. We're trying to get more nurses, medical assistants, advanced practitioners, and physicians through school. And those wearable glasses are actually allowing them to experience a lot more in a lot less time, shorten the time for training without lowering the high skill that we expect folks to graduate with. And we're seeing more and more partners like Health Choice Network and other hospital partners partner with our academia partners to get people through the system faster, because we need more nurses, we need more physicians, and we need people to stay in the community. Our biggest challenge, back to my first example with the African American female that's pregnant, is we need physicians, advanced practitioners, MAs, and nurses that represent the community they're from to treat these patients to be able to use this technology effectively.
This is so important, what we're talking about, because even it's a tool, but communication there's so many different ways to communicate, especially at the human level with so many different cultural differences and whatnot. So it's got to be accurate to a certain degree. I want to ask Ronak this, with the potential of AI-powered chatbots, and that's what a lot of people are using, and they're going to use them for patient education. How can we ensure that these tools are informative, that they engage, they're culturally sensitive for a diverse patient population?
Yeah, that's a great question, Grant. And you're right. A lot of people have started using chatbots, and we are actually designing very large solution on chatbots as well. But the most important part is, first question is how chatbots are designed. when these chatbots are designed, we need to make sure the content that you are using to train the chatbots, that has to be really accurate or up to date, because as the time goes, you have to feed new information to the chatbots as well. So it has to be a smart chatbot which can learn the over the period of time. And the content that you are feeding should have been sourced from the reputable healthcare organization. That's very, very important. Also, at the same time, now chatbots has those should be designed in such a way, so when they are talking to the patient, they should be able to give the output based on patient's diagnosis or their age or their health or their even race. They should be able to even find out. So the chatbot has to be more smarter. I'm not saying they're going to really replace the human, but they can do much better work at the same time as well. And the most important part is, the chatbot should be culturally sensitive as well. We want to make sure that they respect of the different culture and the belief. They have to manage that while while they are actually speaking to the patient directly or chatting to the patient. But the chatbots, the how do you design the engagement strategies are very important. It should be interactive design. So if you see a lot of chatbots, in the real world, where patient is typing something and chatbot is replying something, it's like really, it's not really engaging. I would say, you should really design the chatbots more with like simple quizzes, simple games, or some kind of multimedia content, so patient loves to stay there. Otherwise they're going to pick up the phone and call, okay, I'm done with this chatbot, I need to speak to someone. So we want to make sure that we still give them a great design so they can stay directly. And the conversation style of the chatbot, it should be more like a communication style of the chatbot should be more like natural. It should be like more friendly or easy to understand as well. We are a country of migrants. A lot of people don't even understand very high in English, so it has to be more natural and friendly language as well. And I would say even you can train the chatbots now who is more like emotional intelligent. That's like very big thing. It should respond empathetically to the patient's concerns, because some patients are really concerned and they have no idea, and they start using chatbot, but their problems are bigger than what you would anticipate. And chatbot should really think on that as well, and guide them to the next step. And a bigger thing is, some patients are so old they can't even type. Like, so what in that case? So yes, that's where you do like text to speech or speech to text functionality for even when visual impairments or language barrier patients. And make sure that that you design the overall interface which is more simple and intuitive. So we designed one solution called Instant Consult, and it's an online virtual consultation with a doctor. So the patient can come back to this chatbot. They can speak to the chatbot and they can basically make an appointment, and then it's a full billing, even payment and everything would go through it. But the chatbots are so smart enough, they will speak to the patient, they will identify the symptoms, what is wrong, and based on that they will auto assign the doctor. And then the doctor will take a call with the patient, and then we have a fully automated billing solution. We have a two-way feedback management system. We have an auto follow-up solution with the patient. How did it go with the doctor? And then best part, what we do is we collect the feedback from the patient later on to make sure that the doctor that was assigned was right, or the treatment was given right. And based on that, it does the analysis and gives the rating to the doctor that, okay, this doctor would fit into the next patient with a similar patient or not. So something like that is very, very important. And yeah, so the chatbots are really smarter enough to replace sometimes the human, but sometimes I feel that the human element may require based on the patient's condition.
Absolutely.
It's complementary. I'm going to say complementary.
Yeah, complementary is the key. I know some industries, I think they over automate some things. Like, it's very difficult to talk now to the airlines to get to that human to human without waiting 30 minutes, on the phone, because you just can't get to them. So I think sometimes over automating can backfire on you. People do like talking to people. But then there's other elements, that there is a measure of loneliness in our society, and you just like to at least be able to talk to somebody. And it doesn't always have to be a human-to-human interaction. I think that's where AI can kind of come into that. We start talking, I'm going to direct this over to Alex, when we start talking about striking that balance. You just kind of alluded to that, leveraging. Obviously, you want to have the efficiency, but you've got to have compassion, personalized care experiences, knowing when to have a human to AI interaction, when to have a human to AI to human interaction, or just a human to human interaction.
Right. Well, I mean, there's a very funny credit card commercial that says, "How do I know you're not a robot? Prove it."
I've seen that.
And she's stumped and says, "How do I prove I'm not a robot?" Right? And we know that we'll get there. We'll get to the point where it'll be very difficult to decipher whether it is being responded to or you're even interacting with a bot and or a somewhat AI generative solution model. I think that the biggest challenge we have in the society we have is, for example, I'll use my daughters. My daughters rather text than call. They feel very comfortable on a telehealth call, on a virtual call. They rather share all their history and experiences of the day on Snapchat or one of the social media platforms than actually have a human interaction. And we have to understand society is moving very quickly. But we also can't leave anyone behind. We're not in the banking industry. We're not in the credit card transaction industry. We're not in the airline industry. We are in healthcare. We are saving lives. We are the first line of defense. COVID is a perfect example of when these healthcare superheroes put their life at risk to treat us, right? To treat the rest of the community. So I think it's very much complementary to be able to continue giving them tools and solutions that will make their life better, easier, that would eliminate some of the administrative burden. I know Dr. Risi had put on the chat, what happens when the payers and insurance companies start doing this? Well, guess what? In their war chest today, payers are trying to figure out how to keep dollars where they are, only pay what they have to, and eliminate fraud. That's part of the business. That's why it's called managed care Medicaid or managed care insurance. That's why it's called managed. They have to manage it. We know there's a large fraud population. There's also a large multi-use population. There is a lot in healthcare that could be streamlined as far as reducing burdens and the inefficiencies of healthcare. But we serve a very large mental health population, a very large transient population, a very large immigrant population, a very large, depending on if I'm in Kansas or Hawaii, or if I'm in Puerto Rico, or I'm in Rhode Island, our populations are very different. The idea of empowering, I remember when we launched the first electronic health record back in 1999 and 2000, all I was doing was digitizing paper. I really wasn't solving anything besides losing the medical record and being able to find it quickly. So fast forward to 2024, and we now have tools that allow the limited humans that we have in healthcare right now, because we have a huge workforce issue, to spend more time with the patients and not worry about the administrative burden, not worrying about compliance issues, not worrying about regulatory issues, but really spending more quality time. The average primary care visit is between 12 and 14 minutes. So what happens to that patient in the gray space when they're not in the doctor's office? The majority of their life happens outside of the doctor's office, but that doctor in 12 to 14 minutes has to access everything. And our biggest challenge we have is with social determinants of health. Now a physician says, Grant, do you know where your next meal is coming from? Do you know, are you have food insecurities? Do you have home insecurities? Are you living in a shelter? Are you living on the street? And now I, as Grant's patient, Alex, say, yes, I have a problem. I don't know where my next meal is coming from. The only solutions we've given to these physicians is to pull money out of their own pocket and give it to the patient out of help, because they don't know. Now they're asking questions and they're receiving data and they don't have an answer for that data. So the physicians feel like we're asking questions that they can't solve, and physicians are used to solving the problem. With AI, we now can quickly highlight the fact that if I'm speaking via an ambient system, a voice recognition system, and the patient say, I don't know where my next meal is coming from, AI will automatically make a referral to a local food bank that has funds and food ready to go. But the physician doesn't have a mental database of all the resources that are available. In South Florida, where I live today, we have associations for associations. We have committees for committees, and they're all around healthcare. But it's putting them together and making sure that they're accessible at the time of care. So if I only have 12 minutes, you better give me everything I need, including a referral to a nutritionist, a referral to a food bank, helping with a homeless shelter, making sure that bed is available, making sure there is a medication discounts or coupons or 340B, protecting 340B to make sure our patients get access to low-cost drugs. So I'm excited that I know for a fact we're not replacing humans. I'm excited about the fact we're empowering humans. It's like Batman. I want my physician to have a utility belt with all the tools possible. All I've given them right now is a digitized typewriter in the EHR. Now it's becoming a tool that they could see as proactive and not just reactive. It's looking ahead. It's saying that, hey, I'm turning 50 this year. What do I have to do next year to make sure that I'm healthier at 51?
That is so important. It's the use case, and you detailed that out. We're not, replacing humans. We're actually making that framework entirely more efficient. I like that analogy you just said. It's not an analogy; it's a real fact. You're in the office. Somebody says, "I can't eat. I have nowhere to live." And, you have to. Empathy becomes a real thing, and when you're able to have a solution, you're able to automatically, oh, okay, well, we've got so and so, and all these things happen. That goes to the overall health of the individual, whether it's mental health, it's physical health, or whether it may be. We're coming up to the end of this particular session. This is our part 2. This has been wonderful. We've got about a few minutes left. I want to give both of you the mic. I'm going to start with Rono. I want you to just tell us, considering everything we've talked about, and as AI continues to evolve, there's the regulatory frameworks, we don't even know what they're going to look like yet. They're coming out. Ethical guidelines, ensuring this responsibility that's trustworthy to use in AI. Help us understand that from your lens as a software engineering company.
Sure. I know we have running out of time, so I'll brief it quickly in terms of the AI advances too much. How do you make sure the regulatory frameworks and the ethical guidelines are in place? One most important part is we didn't even talk about data privacy in this whole session. Is we have to make sure all those things you're doing, you're still complying with the HIPAA guidelines, or in the EU region where we work, we have had GDPR guidelines. So that's very important. Now transparency is very important because you're requiring all these AI systems to give you explanations. You're relying on AI systems to give the decisions or recommendations, but we have to get buy-in from the healthcare professionals to make sure that they understand and they recommend these outcomes. So there has to be validation procedures. Even another thing is, I think we should also educate patients sometimes that, these decisions are being taken by the AI algorithms. Patients should have an ability to opt out. Say, okay, I don't want AI to take a decision on myself. I need real doctors to look at it. So because we know that there are biases in the data, there are so many things are happening in the data yard, and we have to make sure if there is no fairness in the data or the data is not mitigated properly, it could create a bigger disaster. And then we have to have an accountability and liability, define the responsibility even for the technology companies, developers, or the healthcare providers, or the regulatory bodies. Everyone should know their role and their accountability when they're defining these AI algorithms, and the clinical validation is very important. We have to implement rigorous testing and validation processes to assess these AI outputs. We have to assess their safety, efficacy on the technology that we are using, and we definitely need a lot of continuous monitoring, and the AI algorithm has to become smarter and smarter by taking the newer data in place. So there are so many things that can be done in terms of the regulatory frameworks on this area.
Well, we've got 1 more minute left. I'm going to give the mic over to Alex. Just sum us up and tell us just a little bit about Health Choice Network and how they can get in touch with your organization.
Well, Health Choice Network is a not-for-profit organization. We only work with safety net physicians across the country and work with FQACs and community health centers and free clinics. Our job is to lower the cost of technology and back office solutions. And our website, hcnetwork.org. It's very simple. And you can always get me on LinkedIn, which is my only social media platform. Grant, I do want to summarize our four-legged stool: increased accessibility, reduce healthcare costs, improve patient outcomes, and make sure that their diversity and ethnicity is inclusive of the data. Those are our four-legged stool approaches here at Health Choice Network. So thank you for these great questions. Radek, I look forward to working with you because I need you to solve some of my stuff.
Definitely. Thank you, Alex. Thank you very much for having us on the live webinar today. Appreciate both of your time. Grant, if you want to complete this and conclude it.
Yes, we are at the end. This has been wonderful. Thank you again, Alex, for taking up your time. This has been wonderful. We're educating our population. We're doing a service for not only South Florida, but the U.S. and the world, because we're all on a new journey with AI. This has been wonderful. Thank you again for being part of the show. Goodbye.
Bye-bye.